Hi everyone, we're going to do chapter 21, Parenteral Nutrition Support. Parenteral nutrition is costly and potentially dangerous. We'll talk about that in a minute. Parenteral nutrition, the formula is compounded by the pharmacy. It is not taken from existing stock. Okay, that's always going to make it more expensive. Enteral nutrition support is preferred, and we always want to bring that thought process home. If the gut is working, then use it. However, what is your role in this? You are going to do a thorough assessment. Candidates for parenteral nutrition are unable to digest or absorb nutrients, are malnourished or likely to become so. The GI tract is inflamed. There is severe tissue damage requiring that you have a bowel rest. So candidates may have intractable vomiting and or diarrhea, severe GI bleeding, intestinal obstructions or fistulas that cannot be bypassed, intestinal paralysis, short bowel syndrome, bone marrow transplants. Contraindicated in patients who are at risk for fluid overload or severe electrolyte imbalance or need the nutrition support for less than 7 to 10 days. So here's one of those handy charts, those yes or no's, and that's going to help you determine what method you're going to be using. Okay, so indications. Book says recent clinical studies have raised some questions about effectiveness for certain conditions. It does not say what conditions are in question, but what the important thing that you take from this is you need to know the policies and procedures of the hospital or clinic or facility that you are working for and make sure that you are working within those guidelines. Select access site. So the peripheral veins are going to be in the arms or the legs. Those are the smaller veins. And the central veins are going to be near the heart. Okay, so peripheral parenteral nutrition PPN. You want to rotate the venous access sites to avoid damaging the veins itself. I've often heard the term like blow out the veins. We are concerned about this. This is not going to be a long-term care because the peripheral veins are too weak to carry much support in them. Okay, so we're talking about an osmolarity of less than 900 mm's a liter. Okay, possible complications are going to be phlebitis, and here you have the support is going to be for less than 7 to 10 days. Now, total parenteral nutrition is a little bit different. It uses the central veins. The vena cava is the one that's often used. And it's preferred for patients who need long-term care. And here's a good chart of that. Okay, so parenteral solutions provide nutrient combinations to meet the patient's needs. Once again, all compounded by the pharmacy under the MD's direction. The MD is going to say, well, this is what we need. And you're going to come in afterwards and you're going to say, well, this doesn't meet this, and this. Can we change it? So amino acids, they're all essential, right? Concentrations range from 3.5 to 20%. You're going to be assessing it at 4 kcals a kilogram. Carbohydrates, dextrose monohydrate, which is glucose. Concentrations given in percent in water and normal saline. Concentrations are greater than 10% used for TPN only. You're going to be assessing that at 3.5 kcals a kilogram. Lipids, they're the essential fatty acids and energy. Okay, and how we do that is it's provided as 10, 20, or even 30% solutions, and you are going to be making sure that your patient has enough. If it's a 10% solution, that's 1.5 kcal a milliliter. If it's 20%, then it's 2.0. If it's 30%, it's 3.0 kcals a milliliter. Lipid emulsions, provided daily. They can supply 20 to 30% of the total kcals. And lipids as an energy source are going to lower the risk of hyperglycemia. Okay, however, on the other hand, we're going to be concerned about hypertriglyceridemia. And that'll be another slide. Okay, Fluid and electrolytes, we're going to be adjusting that daily, or it's going to be adjusted daily. You're going to be watching that and monitoring that. And added electrolytes are expressed in milliequivalents. So if you are going to be looking at fluid needs, you could just do a rough and dirty 25 to 30 milliliters a kilogram, which is going to give you roughly 15 to 2,500 milliliters a day for most people. Okay, vitamins and trace minerals are going to be added to the solution. So we know if someone is on warfarin, we're not going to be giving them vitamin K. But other trace minerals would be chromium, copper, manganese, selenium, and zinc. Okay, and how do they get it? Well, my experience has been it's always been piggybacked on, so it's not actually put directly into the solution, but there will be different portals for different uh, needles. The patient could be on a saline solution or something else, and it's going to be one of the portals, so it's going to be piggybacked on there. Okay, so solutions are highly individualized. Once again, they're made by pharmacy. All right, so they may need to be recalculated daily. You may need to watching. You may have to change things out. Parenteral formulas, TNA, total nutrient mixture. That's what we call when the carbs, the protein, the lipids are all in one bag. It's an all-in-one, a 3-in-1. There's the 2-in-1. So the lipids are excluded and they're in a separate bag. And the osmolarity is 900 mm's, okay, per liter. All right, so safety concerns, once again, nursing is handling all of this. All you're doing is figuring out the estimated needs and making sure that they are met. So nursing is going to pay careful attention to preparation and handling. The pharmacy is going to be providing the solution under aseptic conditions. It's going to be shielded from the light and refrigerated, and the solution and the catheter are going to be checked frequently for any sign of contamination. Okay, so catheters in the peripheral veins have to be inserted by skilled nurses. The central vein catheters are by an MD. That is actually surgery. Catheter related problems, okay, so we want to avoid that. We're going to go aseptic. And so there's a routine inspection for patient monitoring. And let's take a look at this. This kind of defines everybody's role in the whole process.